The great thing about groin pain, apart from the fact that you get to tell everyone, my groin hurts, is that it is very common in professional athletes. And that means the world cares. Why? Well, if all of our professional athletes are out injured, there's nothing to watch on TV, we're all going to start to sit there, we're going to think about our lives, our roles in society and what we do, and then boom, revolution. So, to prevent that, a fuck ton of money is thrown into research and understanding common athletic injuries like groin-related pain, which is the approved medical term we will use from now on. And that means there's a lot of great research out there that shows us just how simple it is to diagnose and treat. Hi, my name is Carson, physiotherapist and pain and performance rehab clinician at Fizzi. And in today's video, I am going to share with you how to self-diagnose your groin-related pain. We're going to be looking at 4 main causes of groin-related pain, as well as sharing the best treatment options and looking at the recovery timeline. The term groin-related pain was created back in 2015 at what we call the Doha Agreement. Basically, a bunch of groin-obsessed weirdos who just happened to work in sports medicine had a big meeting to clarify and answer the following questions. What is groin pain? How many types of groin pain are there? What should we call these types of groin pain? And how can we diagnose them with the highest percentage of accuracy? And this is what they concluded. Groin pain number 1, adductor-related groin pain. This is the most common one by far, and it comes from the adductor muscles and tendons. To diagnose this, it is very simple. You need to have pain on your adductors on palpation, as well as pain on resisted adduction. If you have one or both of those, then you are classed as having adductor-related pain. And this can easily be done at home. All you need to do is lie with your back up and your legs out flat on your bed, on the couch. And what you're going to do is you're going to palpate your own adductor muscles. Now, to do this, you have to find your first point of reference, which is your pubic bone, which, by the way, is one of the most awkward places to palpate as a clinician and as a patient. And if anyone is ever asking to do it, you always have the right to say no, and they should always ask up front. But because you're doing it yourself, it's easy. So all you have to do is go to your belly button and take your second finger and press on your belly button and just start to press all the way down a little bit at a time until you feel a firm, bony, tendery structure and it feels very uncomfortable. Once you've gotten there, that is your pubic bone, and this is where we can go from. Next thing you're going to want to do is you're going to want to move your finger to either the left side or the right side, depending on which groin it is that you have that is painful. If it's the left side, you're going to move your fingers to the left, and you're going to tilt your left heel inward, trying to make it face the ceiling. And this is going to outwardly rotate your hip and expose your adductor muscles. And you're then going to take that same finger and just follow the tendon that attaches onto your pubic bone all the way down into your groin area and into the inside of your thigh. And what you're looking for here is tenderness and pain, that same uncomfortable feeling that you have been feeling since the pain and the injury. That's it. The second thing that you're going to do is you're going to test the strength of your adductors, which is super easy. You just need to put something that you can squeeze in between your knees. It could be a ball, it could be a foam roller, it could be someone else's hands, and they put them like this, one knee and one knee, and hold. And you basically try and push against them and push as hard as you can, squeezing your knees together, and that is going to contract your adductor muscles. If it hurts, the pain is coming from your adductors. You can do this with your knees bent or with your knees flat. And there you go. You just palpated and diagnosed your groin injury. Groin pain number 2 is iliopsoas-related groin pain. To diagnose this, the Delphi study recommends that you palpate the muscle and then also test the strength in hip flexion and then stretch the muscle passively. This is difficult to do yourself at home and also difficult to be done clinically because it has been shown that neither of these tests are that accurate, and I'll explain why. So the first thing is palpation. If we look here, you'll see that there are lots of layers of muscle that sit on top of this iliopsoas muscle is a very deep muscle, and therefore when we add all the layers on top, plus the skin, the fascia, the tissue, you'll notice that there's only a small gap that a clinician needs to be able to palpate to be sure that this is your iliopsoas tendon, and therefore they're pressing on the pain side. So it is not that accurate. Plus, a recent study from 2025 found that the HAC test is a really simple clinical test that you can do that has a high sensitivity. This means that it reproduces pain, and a high specificity, which means that it is the pain specific to what we are testing for. Therefore, if you do this test, you're not going to reproduce pain coming from your back, for example. So this test is easy to be done at home, so you guys can easily do it. And also it's easy to be done in clinic, and you can do it with a lot more confidence. So I think this test should be used instead of what they're saying. And you can see that study in the description below. And this is an example of that test. It is very simple. All you have to do is lie flat on your back, put your hip in external rotation, and then lift, having your foot out flat, and try lift it up as high as you can. And if you feel that pain in here, that is coming from your iliopsoas tendon, iliopsoas muscle, and therefore you would have iliopsoas-related pain. So that's actually all you need to do. Don't need to do the stretch. You don't need to do anything else. That on its own is enough. Groin pain number 3 is inguinal-related groin pain. So this is pain coming from your inguinal canal, which is basically the hole that you have in each side of your pelvis where a lot of our organs and reproductive organs sit. You have a lot of tendons and ligaments in this area, and sometimes it can be a source of pain. To diagnose it, again, it is very straightforward. What you're looking for here is pain in the upper abdominal region, slightly to the left or to the right, indicating which side the pain is coming from. The best way to test it is to do a resisted sit-up. So this works by you sitting up and someone trying to push you down, and that should replicate the pain that you have in your sort of lower abdomen into your pelvis area. If there is a noticeable bulge when doing something like this, then that would indicate that there is actually potentially a hernia or a sports hernia in there, and you should definitely go get that checked. The other way you can do it is just do repeated sit-ups until you start to feel fatigue, and maybe you'll start to feel that pain there as well. And if you want to press in and around that area, it's fairly straightforward. You just need 2 points of reference. Your pubic bone, which you found earlier in the video, and then the front of your pelvis. So you'll notice that if you put your hands on your hips, when they say put your hands on your hips, these 2 fingers are usually sitting on 2 bony prominence. That is your ASIS, as we call it. So what you want to do is palpate in between that bony point and your pubic bone. Pressing along there is your inguinal region, and you should feel some discomfort there. And the 4th type of groin pain is pubic-related groin pain, and this is done by pressing in and around your pubic symphysis and pubic bone, which we have discussed earlier. You want to be pressing around slightly to the left and slightly to the right, as indicating which side the pain is coming from. But if you feel a real increase in pain and extreme tenderness, then your pain is likely coming from this area. For all sources of groin-related pain that we have discussed today, it is highly recommended that you work with a healthcare professional when treating this type of injury, as to ensure that you are performing the right treatment in the safest way possible and to exclude any differential diagnosis and other causes of pain. In terms of treatment, conservative treatment is the first way to go here, which is all about just letting things recover by themselves, doing exercises, doing strength exercises, taking some medications, checking in with your doctors and clinicians regularly. That sort of management approach is usually the best. Recovery time can vary massively. Like, I'm talking 1 week to 1 year. It just really, really depends on the severity of the injury within the 4 different classes, and then also the environment around you, how you're feeling, and what is the process going to be. In terms of the rehab, it's actually pretty straightforward in terms of the exercises. Doesn't matter what type of pain you're experiencing, this would be what you would do for all of them. You would start with some leg swings of the hip in multi-direction and standing, focusing on flexing forward and going out to the side in abduction. You would then start to gradually build up the strength of your hip again by using something like the cable machine or resistance bands and working on mainly resisted hip flexion and resisted hip adduction. After that, you're going to start to work towards the daddy of all groin-related exercises, the Copenhagen side plank. You're going to do this isometrically with your knee bent. You're then going to perform repeated contractions. And then finally, you will do it with your legs straight. During this as well, it's also important to train your hip abduction, as this is really good for the hip in general and helps deal with the side pain. This rehab process is very gradual and, like I say, can take a long time. And that is everything you need to know about groin-related pain, the 4 main types, and how to diagnose each of them, as well as a quick overview of the rehab options out there. Now, if you would like me to do a full video explaining the complete rehab process from initial injury to sport-specific drills and exercises, let me know in the comments below and I will make that video. And please, if you've been enjoying the content, subscribe to the channel so that you never miss the next video. And you can also increase my reach and I can help get to more people with my videos. That would mean the world to me. And also, if you can, please share this video with someone that you know. Maybe they have some sort of groin-related pain and this video can help them understand what's going on better. So share it. The more people who get these videos, the better. That is my goal here. I want to help and educate. So please share, share, share.
Free audio post-production by alphonic.com.